Hello guys, welcome to my channel. Today I'm going to discuss the topic Indian Medical Council. It is constituted under the Indian Medical Council Act 1956. So constitution, like whoever are present in this Indian Medical Council, it is a constitution. Firstly, one member from each state, and the member is elected or nominated by the central government, and one member from each state, elected by the registered medical practitioner. Like one member is nominated by the central government, and one member is selected by the all the doctors, like all the registered medical practitioners, and one member from each university. And a president and vice president are elected from these members. Like from all these, one president and vice president is elected, and they form an executive committee, which consists of a president, vice president, and 7 to 10 members, and they hold this committee or they hold this office for 5 years. So, like the summary is, it consists of one member from each state who is elected by the nominated by the central government, and one member from the each state who is elected by the elected by the registered medical practitioners, and one member from each university. And from all these elected or nominated people, we choose a president and vice president, and they form a committee which consists of that is known as executive committee, and it consists of the president, the vice president, and 7 to 10 members, and they hold this for the 5 years. Like hold this office, or they regulate it for 5 years. Next, the next is like the functions of Indian Medical Council. Firstly, they gave us a mnemonic like DEAR. D stands for disciplinary control. E stands for education. A stands for appeal. R stands for registration, and dear friend, like F stands for foreign medical registration recognition. Okay, now the D, disciplinary control. The council prescribes standards for professional conducts, etiquette, ethics for members of medical profession. Like etiquette means like good behavior. Like it consists of like how doctor have to behave and all the rules the doctor have to practice. So like they deal with it, and from time to time the council publishes warning notices, prescribes the offences amounting to professional misconduct. Like what are the offenses, what are the professional misconduct the doctor practice. So they include the adultery and addictions, like the doctor performing the like surgery or any treatment, like while he's an addiction, while he's like he consumed alcohol, and he's doing any like he's giving his treatment addiction, so he's addicted to some like drugs or like something else. And alcohol advertisement, like you should not advertise about this hospital and all. And criminal abortions, associations, covering dichotomy, employing agents, failure to take consent, etc. So these are few examples of offenses. Okay, next, from if at all a doctor does this, he'll get a warning notice. If at all he repeats it, then they will give some punishment, like erasing his name from the register, or like something like that. Then like education. So National Indian Medical Council, or National Medical Council, they deal with the education of the like graduates. Like it maintains the standards of undergraduate and postgraduate medical education. MCI inspectors, like Medical Council of India inspector, like we'll see many times the many like people will say that we have inspection of hospitals. So these people like MCI, Medical Council of India inspectors, visit the hospitals or institutions and conduct inspection according to the prescribed standards of MCI. They also assess standards of examination held in the institute, send report to the government of India for recognition or de-recognition of the institute. So the people of this National Medical Council or MCI, they come to the college, they see whether it's good or not, or the standards are maintained or not, or the exams are conducted in a good way or not. Then they will just give the report. If at all everything is up to the mark, then they're like okay, it is recognized, our medical course is recognized. And we have seen many colleges they lost the recognition because it are not up to the standards. So yeah, that's what it is. And One more thing is appeal. The doctor whose name is removed, like appeal means we can complain. Like the doctor whose name is removed from the national medical state medical register or fail to get any refund from state medical council can appeal the central government. The central government consults the MCI and gives its decision. Okay. Like registration. The council maintains a register of medical practitioners known as Indian Medical Register. It is maintained by the registrator. When a fresh medical graduate registers with any state medical council, his her name is automatically registered in the register of MCI. Registrator is responsible for any additions or deletions of the name. Okay. So now if any person's completed his internship, so now we have to go and get registered in the in the medical state medical register. When he registers in the state medical register, it automatically updates into the um, medical council of India, register of medical council of India. And if at all, if we do any misconduct or a professional misconduct, then our name will be erased from it, may it be temporarily or permanently. So they maintains the register. And foreign medical recognition, for example, I have seen many friends studying in like other countries like China, Russia and all. So if at all, they are not allowed to practice as a doctor in our country, but once they'll conduct an exam for them, if at all they qualifies it, yeah, they'll get a their certificate is recognized in India, so they can practice. This is what it is. Indians acquiring medical degree from foreign countries which is not recognized appeal to the council for recognition. MCI conducts exam for such candidates and degree will be recognized accordingly. Now the notes like schedule of MCI. They have three schedules: one, two, three, and three has part one and part two. In one schedule, it contains recognized medical qualification granted by university in India. Second schedule or schedule 2, it contains some medical qualification granted outside India. Third schedule, part 1 and part 2, additional qualification granted in India, and 3, additional qualification granted outside India which are not in schedule 3. Just remember the schedules 1, 2, 3 and part 1 and part 2. That's it. Thank you guys.